for choosing to come to this session. I'm Elizabeth Sobel Blum. I've been with the Dallas Fed now 12 years. I can't believe it, but it's been such a gift to be able to represent the Fed. So today what we're going to be talking about is investable opportunities in healthy communities. And to make sure we're all on the same page about what healthy communities means, in layman's terms, the way that we tend to define it is it's the intersection of four sectors: public health, healthcare, community development, and economic development. So where everybody it's those places where our work overlaps. And just like David was talking about before, a lot of times when you see the maps of where you see the biggest housing issues, poverty issues, education issues, income and wealth gaps, etc., those are the exact same neighborhoods. And so there's been a lot of conversation over the last 10 years or so about how to, rather than we rubbing elbows in the same communities, how do we actually link arms and coordinate and collaborate in very strategic, smart ways to make sure that we are actually making the impact that we want to in a sustainable way for the greatest good for the greatest number of people. So that's just a little bit about healthy communities. Let's get started. Quick disclaimer, these are my views and not necessarily representing those of the Dallas Fed system. We're as happy as not by making that comment. Okay, so first off, health is an asset. This points a lot to what David was talking about this morning. Well, we know that there's an inextricable link between health, income, and education. Let me give you just a couple of statistics that give an example of how they're interlinked or interdependent. First of all, we know that in general, the more you learn, the more you earn over your lifetime. Pretty obvious, right? Second of all, just like David was saying, the Commission to Build a Healthier America, which the Robert Wood Johnson Foundation brought together, twice actually. Most recently, they published the publication Time to Act, which was published, I believe it was January of last year. But they talk about how people who graduate from college at 25 years of age are more likely to live 8 to 9 years longer than their peers who have not graduated from high school, and 2 to 3 years longer than their peers who have not finished college. Pretty striking, huh? And then we also know that in general, kids from the lowest income households are more likely to be overweight or obese by 2 to 3 times than their counterparts who are not low income. So we have a lot of work to do, but it's not just about continuing working in our silos, but being very strategic about partnering. So zip code matters. David showed an example of Minneapolis, but I wanted to show New Orleans just to show you the stark differences and how much a difference it makes in terms of your environment, where you live. So this map was created by, this is published in the Commission to Build a Healthier America report. It was published by Virginia Commonwealth University, who Robert Wood Johnson Foundation partners with to build these maps, and they're doing it all over the United States. They just did one in El Paso. They haven't done one for all the zip codes in Texas, but there are a lot of different places around the United States where they're building these maps to show, in a very simplistic and powerful way, look how much place matters. So this data, these are not outliers. This is showing that, for example, if a baby born in a neighborhood near the French Quarter can expect to live up to their age of 55 years old. Several miles northwest of there by Lakeview, a baby who's born by Lakeview can expect to live to the ripe old age of 80. This is a whole generation lost, and this is preventable. So when we're talking about our policies, our programs, our practices, what we need to keep on focusing on is this is preventable. How do we make sure that we're moving the needle forward so that everybody has that equitable chance to live to their fullest potential? Okay, the social determinants of health. I know this terminology has been used again and again this morning, but I just want to make sure we're all clear. Social determinants of health are what community and economic developers have been addressing forever. This is what we do. But the public health and healthcare sector, this is what they call our work. Okay? And so what it's basically showing is that of your health status, your quality of your health, and your longevity, how long you live, 80% of that is determined by what happens outside the doctor's office. So what you eat, how much you exercise, what your healthy opportunities are, very much impact the quality of your life as well as the length of your life. So who do we engage in this whole conversation? And so when we're talking before, we have with Annie and Julian and Noni here, we're talking specifically about what their work in their respective communities. I want to put in context of what they're doing. So they're all in the zip code improvement business. This is basically for the public health and healthcare industries. They asked me about what is community and economic development and why should we partner with you. This is what I say in a nutshell. Community and economic development builds affordable housing. We talk about micro-entrepreneurship, building community facilities that otherwise would not be built, helping make sure that people have access to quality financial products and services where otherwise they may not have access to these products and services. Now, under the CRA, can I see a show of hands of who's familiar with CRA in this room? Oh, good, so the great majority, great. Okay, so for those who, just briefly for those who are not familiar with it, the CRA is the Community Reinvestment Act. And in 1977, the CRA, Community Reinvestment Act, was passed. And specifically made redlining by banks illegal, which meant that it used to be that banks could look at a map and draw a circle around a certain area and say, we'll either totally ignore it, we'll not make any investments there, or we'll accept deposits, but will not extend credit, will not make mortgages, will not extend business loans, etc. And it wasn't just that you think, okay, well, it was racist banks. I mean, that's what people's gut reaction, but it's because the federal government refused to back those loans. So in 1977, there were a whole slew of other, besides CRA, around that time, there were a whole other group of regulations and laws passed, the Equal Credit Opportunity Act, Home Mortgage Disclosure Act, a whole bunch of other ones too. They're basically making sure that everybody has access to fair access to quality financial products and services. Okay, so banks are incentivized with the CRA to invest in community development. So what does this mean? When the healthy communities conversation really started being part of public discourse. This was about 10 years ago, right after the Affordable Care Act, actually right before the Affordable Care Act was passed. People kept on asking me, especially bankers, were saying, "What does healthy communities mean? What does it matter about? Is this about ordering a salad at lunch?" And so my response was, well, yeah, kind of, sort of, but it's a little bit broader than that. So what I did is, in response, I created a publication that shows what healthy communities are. What are these components of healthy communities? All of these are areas where all of you all represent these different areas within community and economic development. And so what I did is said, okay, for all those bankers out there and those organizations out there who want to partner with banks and other organizations that they're rubbing elbows with but not yet partnering with, here's a list of the types of organizations that are in every single community in one degree or another. But you can tell, you can do it, if you work together as a community, you can talk about, well, where are our strengths, where are our weaknesses, and where are opportunities to address these weaknesses so we can become stronger, more vibrant, resilient as a community. So I created this checklist, and so I just highlight here in yellow, access to medical care and built environment, because that's what we're talking about here today. But frankly, it's not just about these investments. All of these are investable opportunities. Now, with this publication is an appendix. It's all online at dallasfed.org in our Healthy Communities Resource Center. There's an appendix of over 50 healthy communities experts across the country. And the CFED is one of the examples of these experts. And what we do is we list, this is information straight from their website. So it's their information, not ours. But basically, over the years, as we've seen, who are experts who are quoted again and again, their data is used and they've been very effective in making sure that they're making inroads in communities where they're suffering from incredible underrepresentation and disinvestment. These are communities, organizations that are doing tremendous work, and they've been doing the work for years. So CFED is one of them. And so in this appendix, I created this appendix of over 50 organizations where we categorize what specific healthy communities components they're investing in. And so these three are the ones that CFED is invested in. So I welcome you to go to our website to be able to see this so if you can identify who to partner with. And I know I only have a couple minutes, but I want to really quick go to recommendations for action, because everybody asks, okay, this is pretty esoteric, what do I do now? So really quick, prepare your story by putting it in a healthy communities perspective. Talk about the inextricable link between health, income, and education. Talk about why zip codes matter. Zip codes tend to be the greatest predictor of health in terms of quality and health and your longevity. Talk to others about how your work is fundamental to healthy communities, and talk about the value of your work socially, financially, etc. Next, reach out to experts in healthy communities, such as those listed in the appendix. Advance health promoting laws and policies. Don't be shy about this. We have to make sure that laws and policies are included in our work. Programs will not get at it alone. We have to create the system level change in order to make healthy the norm for everybody, for all Americans. And this is the example of power of laws and policies. When you see pathogenic neighborhood conditions, like it's very difficult to find healthy food in a neighborhood, junk food, tobacco, and alcohol are easily accessible and heavily marketed, when you see few parks and playgrounds and they're poorly maintained, these are pathogenic neighborhood conditions, and policies and laws can help change those environmental risk factors. Next, address the elephant in the room, racial inequalities. Get training on how to develop a shared understanding about inequities, and learn how to have a productive conversation about it. Yes, it's scary, but there are a number of organizations that are high-quality organizations that do training on how to address racial inequities. Some examples are those at Policy Lake, the Center for Social Inclusion, and Race Matters Institute. Next, as you decide to address health and safety issues, engage community residents and the communities that represent them as too. Ask them what kind of change they want to see, why, what will work, and what won't. If you don't engage community, it's not going to work. Next, use your expertise to promote a culture of health. Be an advocate. An advocate can be just educating and influencing. It's not just about saying, this must be done. It's about saying, did you know this is the data? We need to address this and for the betterment of our society and our economy. These are the reasons why. Sit on boards in local nonprofits, write an op-ed piece, participate in local meetings held by local government. It's really important for you, clearly, as we've seen especially this past week, civic and political participation is so critical to the health and strength of our democracy. Number 7, cultivate and promote a culture of health in your workplace. For example, is soda and junk food a part of all your meetings and in your vending machines and your cafeteria? How are these foods and beverages priced? Are the healthy ones expensive and the unhealthy ones cheap? Think about those things, because it's not just about it's about practicing what you're preaching as well. And to find success, not only what works, not only by learning what works, but what doesn't work. Be courageous to be able to say, you know what, this is not working, so we're not going to keep on throwing good money after bad. Put money where you see if things are working and see where you can continue. So that is just a very brief overview of the Dallas Fed and our work and how, in our perspective of healthy communities. Now I'd like to introduce you to our 3 incredible healthy communities experts. So I personally chose them. Emily was very generous and said, have at it, you get to choose who gets to be in the session. And so these 3 are these rock star people in healthy communities, seriously, in the healthy communities world. So first off, we have Annie Ward. I first met Annie when she was at Citi, and now Citibank, and now she's at City Square, which is in Dallas. Then there's Julian Huerta from Foundation Communities, based here in Austin. And of course, last but certainly not least, Noni Ramos is from Enterprise Community Partners. So Annie, will you please start about the work that you're doing?
Great, thank you, Elizabeth. Good afternoon, everyone. I'm just going to double up on my devices here. So, notes on this one. Great, so I'm just going to talk a little bit about how City Square, the organization I work for in Dallas, is integrating housing, especially permanent supportive housing and health in Dallas. Just to give you a little overview, our mission is to fight the causes and effects of poverty through service, advocacy, and friendship. And we have a host of programs. Just a brief overview. We've got 450 units of permanent supportive housing. We have a health clinic that we operate in conjunction with Baylor Scott & White. We offer workforce development services, financial empowerment. We work with youth aging out of foster care, and we also have a food pantry that serves about 15,000 people a year. So, really briefly, I just wanted to orient you to how we're measuring success currently with permanent supportive housing. And I'll kind of give the disclaimer that these are kind of like proxy outcomes. This is what we report to HUD, basically. And it's great, but I'll tell you why we're kind of hoping to do more. Right now, we measure our occupancy rate, which is about 94% right now, retention after 6 months in housing, 92%, and then how many people later have income once they get housed with us, and we've moved from 22 to 66%. Our objective with our housing is really about helping neighbors improve and stabilize their behavioral, their physical, and their financial health. So these outcomes kind of get us there, but what we're working on right now is how can we be better measuring physical health outcomes after housing, financial capability after housing, food security, and social connectedness. So about a few years ago, actually when I first moved to Dallas, and I was working for Citibank, Larry James, who is CEO of City Square, approached me and said, "We want to build 50 tiny homes for the hardest to house individuals in Dallas County." And I was so inspired and, rapturous as I listened to him, and I thought, that will never occur. And it's happening. We have built the 50 homes, and we're moving in our first neighbors this week. Neighbors is how City Square speaks about our clients. Really, it's a very exciting time for us at this moment. So what we've done is to create a housing first model, and maybe all of you are kind of familiar with that, but for those of you who aren't, housing first makes no behavioral requirement of homeless individuals before housing them. So basically, it removes barriers to housing, and evidence shows that when you do that, people tend to maintain their housing better, they perform better in terms of their financial capability, and their health outcomes are greatly improved. So we assumed that the 50 the most vulnerable homeless individuals on Dallas's streets would also be the heaviest users of county services, right? So that includes ER visits, ambulance, law enforcement, jail time. And so we made jail time or interaction with the criminal justice system, as well as interaction with the public health system, 2 criteria, heavy use. And then we also assumed that the most vulnerable homeless individuals were also going to have really serious mental health diagnoses. And Access 1 is sort of jargony, sorry. It's bipolar disorder, major depression, or schizoaffective disorders, right? So these definitely require medication. So with these 3 criteria, plus the definition of chronic homelessness, which is homelessness for about a year, we then estimated the cost of an average year for this person to live on the streets. And like many other cities across the country, we estimated about $40,000 a year. And we did that in conjunction with the Dallas County Criminal Justice Department, as well as with Parkland Hospital, our public safety net hospital. And we have estimated that the services that we're going to provide once we've housed these individuals will cost about $15,000 a year. So we were unable, after intending to make this a pay-for-success model in partnership with Dallas County, we approached that and tried to make that happen. We were unsuccessful so far, but we're very excited about the prospects of this. When we do our evaluation over the next year and then thereafter, we are really hoping that we can demonstrate that there is a viable social impact bond model that can be accomplished with programs like this. So it's kind of a and then this is really just a summary of the services that are going to be provided to the individuals we'll be housing in our cottages. We have a very serious number of people in behavioral health serving this population. A clinical manager, qualified mental health professionals, licensed professional counselors, a part-time psychiatrist, peer support specialist, and an advanced practice nurse. We also have physical health services and case management that's intensive. We'll also be integrating some best practices, and this is kind of an incomplete list, but just to give you an example. Some best practices including trauma-informed care, motivational interviewing, which is kind of like a coaching model instead of a case management model, if that makes sense to anyone. And then also, I didn't add this here, but we are also looking into evidence-based Eastern practices. There is really an interesting body of science that's showing that controlled breathing and yoga practice can have the same impact on major depressive disorder as antidepressants. So we're exploring this. The partners that have helped us make this possible include Metro Care Services. They're providing all of our behavioral health services. Baylor Scott & White, like I said, this is our partner on our health clinic. UT Southwestern is going to be doing all of the program evaluation, and that will include understanding the decrease in the cost and the use of county services. And then, like I mentioned, Dallas County Criminal Justice really helping us set the stage and do intake and identification of the individuals that will go into the cottages. Our funding sources from sort of largest to smallest. The Cruz Foundation came in as a big supporter. We had a number of very large individual donors. City of Dallas, Dallas County, Corporation for Supportive Housing, and churches. And the connection between individuals and churches was really important in our case. So let me just give you a little, one more slide before I give you a little tour with photos. The value proposition really here. What captured people's imagination with this project? The first thing was the humanity of it. It's the right thing to do. These are individuals that really don't have anywhere else to go. With their criminal backgrounds, even with a housing voucher, even with completely subsidized housing, they're really not going to get accepted into an apartment complex. A lot of people really warmed up to the cost effectiveness of this. When you're talking about a $25,000 saving per person, that spoke volumes, especially to city government, county government, but also to individual donors. Public safety, that's what drove the Cruz Foundation to make an investment with us. They were concerned about, the public safety of having individuals who are not stable on the streets. I'll hold on to this last note. There were no participating financial institutions in this, so I know Elizabeth's going to ask us questions about that separately. So I'll just take you on a tour. I don't know if you can see this very well, but we've almost done all the landscaping, so it's not quite complete on the grounds, but the cottages themselves are complete. This is the interior one. They're about 450 square feet each. It's one bedroom. There is a kitchenette and a shower. They're very pleasant, very high ceilings. And it's aluminum roofing and siding, and then you have Allura siding on one exterior wall. You've got paneling that on the outside that is birch wood, inside is maple, and on the cabinetry is maple. And they're in these communities. They're sort of like organized into pods. So each individual, this is SRO, the single resident occupancy housing. But they are organized in sort of pods with each other, 8 cottages at a time. Again, more photos. And that's the service center where a lot of our services will be provided. There's also a laundromat on site. And there is a big green space as well that's currently being landscaped. My last slide, just looking forward, what we're trying to do with our housing is really to integrate intensive physical and behavioral health across all of our housing programs. We are currently realigning our clinics so that we can target, serve our target geography and our target population, which currently, because of moving the clinic and also not necessarily doing the best we can on outreach, we're really working hard at that right now. Additionally, we are trying to increase access to behavioral health across all of our housing programs, which is a very big challenge. It's true in Texas all over, but in North Texas, it can be particularly challenging. I'm happy to answer questions about that, but we're looking for solutions in case any of you has one. And then lastly, we're interested in integrating asset building or financial empowerment services into more of our housing programs. And this is a really interesting area that I haven't seen a whole lot of, I haven't seen that many forward movers on this yet. So it's kind of new to integrate, for example, financial coaching in permanent supportive housing or in housing where you have a high incidence of mental health or behavioral health disorders. So I'm curious what's possible there. And especially among those who are earning their income, that's really where we're seeing great traction with our Working Family Success Model, which is a partnership with Annie Casey Foundation. So I will stop there. Thanks very much.
Good afternoon, everybody.
Hello.
So I'm Julian Wedeth. I'm with Foundation Communities, and great. So I'm going to do a little. I'm going to tell you about kind of the work that we do in housing and health. I'm going to talk a little bit about how we fund that, and then I'll tell you a little bit about kind of what we've got coming up in the future. I've brought a lot of pictures so you guys can sit back and relax there. But first off, so we're a nonprofit organization based here in Austin. Primarily what we do is provide affordable housing. We have 19 properties with about 3,000 units of housing. Most of that in Austin, but we do have 3 properties in the Dallas area. We really believe in this model of housing plus services, so that we know that it takes more than getting a roof over somebody's head to help them really advance educationally and economically and to have a better life. And then we also run a whole range of financial programs that are available to people throughout Austin and in Dallas too. And that includes free tax preparation, which we do for about 20,000 people here in Austin, financial coaching and money management classes. We also help people with FAFSA preparation, and we help people enroll in health insurance. So this is sort of, it's definitely health related, but I'm going to focus on my talk here on the stuff we do within the context of our housing. But last year we helped about 5,000 people purchase health insurance through the marketplace. So we basically have two kinds of properties. We do family housing for mostly families with kids, and then we do permanent supportive housing like Andy does. And so just a little bit about each of these. So 14 of our properties serve families with kids. We really believe in making our housing indistinguishable from market housing, right? And the test we use is, would I live there, right? And when you see that's our Homestead Oaks, which just opened at the beginning of the year. Like, yeah, I'd live there, right? And that's important, that people be able to take pride in kind of where they live. We also do lots of green features in our properties. You can kind of see on all the roofs there are solar panels, there's water collection cisterns, and lots of other things that sort of make the properties very green. We have learning centers at our family properties, and so this is the learning center at Homestead. So there are classrooms and computer labs where we do after-school programs for kids, lots of adult education, and lots of other programming. Okay? And there's really stuff going on from morning to night. And then we also do permanent supportive housing. So this is housing that is single room occupancy, so just one person per room. We do it all bills paid. Many of our residents are formerly homeless, and in a lot of the properties, most of them are formerly homeless. Because of that, we know that we have many residents who suffer from mental health or substance abuse issues, and so we do a lot of programming around that. And because we're housing people who are coming out of homelessness, keeping them housed is the #1 goal, right? Everybody knows that's what we're focused on, because the alternative, if somebody can't make it in our housing, is to return to homelessness, right? And so we want to make sure that doesn't happen. So this is Capitol Studios, which is downtown, not just a few blocks from here, actually. And then this is just kind of the courtyard at Capitol Studios, which is one of my favorite spots, although you can't see it that great, but it's beautiful, promise. So why are we involved in health programming? So for us, we know that our residents, because the majority of them are people of color, and we know that people of color and lower income people suffer from higher rates of things like diabetes and hypertension, and so we want to address those things. We also know that in our permanent supportive housing, we have pretty high rates of mental health and substance abuse issues. And so we want to be able to help our residents through those things. We also know that housing is a great platform for providing all kinds of programming. We've seen that over many years. We know that good health can help people get and keep employment, right? And also have stability in their housing, which again is super important, especially for people coming out of homelessness. And we know that being healthy means a better quality of life, right? And that's really the most important thing. I have your basic social determinants of health slide there, and so I think the point here is that we do a lot of these things, in having sort of a place where there's comprehensive sets of services, we can address a lot of those areas that impact health. And so here, when I think about our health work, I think of it in really 3 buckets. And so these are the things that I'm going to focus on a little bit more. So healthy homes and environments, prevention, programming, and on-site care. Okay. And so in terms of a home and environment, so it really starts with the apartment that somebody lives in. So when we build housing, we try to make it, of course, top quality, but we also do things like we don't use any carpets in our housing, because carpets can aggravate asthma and other sort of respiratory conditions. We use low VOC paints and low formaldehyde cabinets, which all contribute to better air quality. We have high quality HVAC systems, which also can help with air quality. And then, and like all the new housing that we've built, and then plus going back to some of our existing properties, we've decided that we're not going to allow any smoking inside of our properties, inside of our units. And this is a little tough because that's somebody's home, right? And it's hard to tell somebody what they can't do in their home. But you know, if you're about health and housing, you gotta do some things that are pretty tough. And so people know that when they're moving in, and then we've definitely been working with residents at the properties where we've instituted this after they moved in to help with like smoking cessation classes and things like that. Okay. We also have lots of great outdoor spaces. So that's the playground at Homestead Oaks. There's also like a sport court and a walking trail there. That's the workout room at Capitol Studios down the street. This is the kind of the trail map for the Fitness Camino, which is a walking trail that goes between two properties that we have that are right across the street from each other. So it's almost a mile trail, and it has lots of kind of exercise stations all along that residents can use. And then this is a healthy vending machine. And so the kinds of food that people eat is an important thing. And so we are trying, we're sort of testing this out to replace some of the typical vending machines with things that have healthier options. This is not necessarily an easy thing to do. You know, people are pretty attached to their Snickers bars and Dr. Pepper. Right? But we're trying it. And you know, when we brought this out, we had sort of these tasting sessions where people would come and taste some of the different things that are available in the vending machine. And I was happy that when we took this picture, there's actually like 3 or 4 of the items are actually sold out. So I think that's a good sign. And then we also do lots of prevention programming, right? And so you know, this is a picture of a Zumba class that we have in one of our properties. I wanted to insert like a video here with music, but I couldn't figure out how to do it. So just imagine some loud thumping pit bull, like, you know, playing here. But you know, this is very popular at our properties. We will have 30, 40 people come out for Zumba classes that happen regularly. This is the blood pressure screening that we're doing at our properties. We set a goal for our health initiatives team to screen 1,000 of our residents for blood pressure, just to help people know what their blood pressure is and refer them to help if they have really high blood pressure. This is a nutrition or cooking demonstration. We do that pretty regularly, and actually one thing that we found that works really well is to do this in conjunction with like the Zumba classes or something. And I don't know about you guys, but I always feel like after I exercise, I would actually want to eat healthy. You know, it is more motivated to do it. And then this is a picture of the Spring Terrace 2-miler, which is an event we've done annually here for a while at one of our properties. And so these are residents doing like a 2-mile community walk. And it's really cool because they all have like race bibs, and we have a finish line, and there's like a DJ going. So it's a great community event, but just to help get people excited about health. And then kind of that third area is about having the on-site integrated care. Okay, and this is something that we do primarily in our supportive housing. And again, the key goal is to keep people housed, and so we know that particularly if people have mental health issues, if we let those go unaddressed, that can endanger their ability to stay on the property. So one great partnership we have is with community care clinics here in Austin, and they actually bring a team once a month to each of our supportive housing facilities. That team includes a doctor, a nurse, a nutritionist, a case manager, and they see our residents as patients. They can actually get primary care that includes behavioral health care right there on site. And we have case managers who help sort of facilitate all that, right? Like during, in the week before the clinic's going to be coming, they're making appointments with residents. And then that day they're going out there and knocking on their doors and saying, hey, remember you've got this appointment, and making sure that people are taking advantage of that. We also have partnerships with like Lone Star Circle of Care and Austin Recovery to provide additional sort of support, especially around sort of mental health and substance abuse. So here's the question that I'm always thinking about is how do we fund this stuff, right? We're doing a lot of things, and when we think about our funding, we really need two kinds of money, right? We need capital to build properties and to build walking trails and things like that, and we need operating support, okay? And so we get that in some different ways. So in terms of government funding, I mean, most of the funding that we use to build a new property comes from low-income housing tax credits, which is a federal money that's administered by the state. But we also, and then we are very lucky to be in Austin, where we have, the affordable housing bonds, and so that money has helped to do every one of the projects that we've done in the last several years. So that's really important. We've also been able to get some operating money through a federal grant, like SAMHSA, Substance Abuse Mental Health Services Administration, was one of the funders that really helped us move our services in supportive housing forward. We get money from the City of Austin for a lot of the services we provide now. That money comes through 1115 waiver. Do people know what that is? Sort of, it allows states to use Medicaid money in more innovative ways, and so that's helped to fund some of the things that we're doing, and we know that that's having an impact on people's health. We also get lots of foundation and corporate grants. Most of that is for operating support, but some of it has gone to help build properties. The big challenge there was helping funders understand that yes, we do housing, but that also means health. When we first went to some of the foundations that fund health, they said, "Oh, we don't fund housing," right? And so we had to sort of make that case. And of course, now with all the work that a lot of people here are doing, that's a much easier sell, right? And then we also get some funding from individuals, and then we're also exploring, can we one day build Medicaid for some of these things that we do? Because under the Affordable Care Act, a lot of those things that we do in supportive housing are potentially billable. And then I know I'm out of time, so one thing I'll just say is our biggest problem is we are so full. We have waiting lists at every property. We just started taking names. We're taking people onto a waiting list for a supportive housing facility on Lamar that has about 120 units. We have like 700 people who are on the list for those 120 units. And it's really tough to always have to tell people, we don't have anything for you. So we've got 4 new properties that are going to be opening up over the next year or so, but I mean the demand will definitely continue. Okay, so I'll stop there. Thank you.
Good afternoon, everyone. So once again, Noni Ramos with Enterprise Community Partners. And for those of you that don't know Enterprise, I think David Erickson mentioned us as he was giving his initial comments this morning. So we are a national nonprofit intermediary. We focus on finding community-driven solutions, innovative financial opportunities, as well as advocacy. Over our 30-year history, we have focused on the platform of affordable housing and ensuring that low-income communities have access to healthy, quality, affordable housing in thriving communities, recognizing that although we can have great housing in a community, if we don't have the other components of education, of healthcare, of healthy food, of jobs, that housing alone cannot change a community and cannot change the life of the residents that we're focused on. So that's an important component. There's just a few statistics on what has been accomplished through our 30-year history. The map here shows you where we work. We are a national organization, but do have some very focused, targeted areas, specifically 10 markets throughout the United States. We're a family of entities. So Enterprise Community Partners is our parent, but we have a family of entities that provides capital delivery, and I'm really going to speak to that today as the capital person, I think, on the panel. So hopefully that will be helpful for folks to understand. As I noted, we have several different mechanisms through which we deliver our programs and services. So we have our markets, we have our national initiatives, and as you'll see here, much of what we heard earlier in the day really fits very well and is complementary to what we have prioritized as our national initiatives. We're in communities, so more than a decade ago, Enterprise really put a stake in the ground around the fact that we not only needed to build affordable housing, but we needed to build healthy affordable housing, and we needed to focus on the health of the residents and what that built environment meant to their health, while at the same time trying to ensure the energy efficiency of affordable housing. And so we were very very successful from an advocacy standpoint to create some requirements as it relates to some of the federal programs that fund affordable housing, namely the low-income housing tax credit and the QAPs. So those are the guiding principles that each state uses to allocate their low-income housing tax credit. So green communities, we're very proud to say that enterprise green communities is one of the criteria that can be used for a developer to compete. We work in the homeless and supportive housing arena, health and housing, and then transport-oriented development, which again we heard a lot about. We for many years have been speaking in terms of housing plus transportation, so H plus T plus E, so housing, transportation, and education. So all those pieces are just really interconnected, and you really can't focus and speak about one without touching on the others. So coming from an entity that was originally founded as a housing organization, I think that's really important for us, particularly to speak in these other terms and collaborate with the other sectors. So on the capital side, really what we pride ourselves in being able to do is be a translator, if you will, between communities and the capital markets. Again, I heard a lot earlier in the day about the fact that we need partnerships, and we need partnerships across sectors, whether that be housing, healthcare, whatnot, but we also need partnership with the public sector, with the private sector, with the nonprofit sector. So we all need to focus our energies and really kind of play to what our strengths are and then be complementary to each other. So I think that is one of the things that we bring to the table, is being able to do that from a capital standpoint in particular. One of the tools that we use for the capital delivery is an entity called Enterprise Community Loan Fund. We are a community development financial institution. Again, David mentioned CDFIs today. We're an industry of 600 plus in the country. So Enterprise is just one of many, many talented organizations that are working throughout the United States. Some very locally, some are city specific, some are county, state specific. Others, like Enterprise, do work across the country. So if you don't know of those type of entities in your community, I would encourage you to try to find those organizations. I'm sure the Fed would be happy to make connections because that's something that you were interested in. So I would encourage you there. Just a few stats on the type of work that we've done, what we finance, the type of assets that we manage. What we do is we actually borrow capital. So we are an intermediary, so we borrow capital, and I think one of the things that Elizabeth had asked us to talk about is our partners. So our partners in the capital really are financial institutions, many of them because they are motivated by CRA is one of the reasons, but that's not the only reason that financial institutions invest in an organization like Enterprise Community Loan Fund. We have, over our history, really been able to demonstrate that an investor can hit a double, maybe a triple bottom line by investing in an organization like ours. So there is an economic return. It might be lower than market, but there are reasons why a financial institution may be willing to take a lower than market return, because there's also a component of a social return. And then if you layer on top of that, with the green communities, kind of the green component of it, that you can really start to see that there is kind of a culmination of the work that we accomplish as a CDFI. The other piece of capital I wanted to mention was another tax credit program. So Julian mentioned the low-income housing tax credit. There's a parallel program called the New Markets tax credit, which dates back to about the year 2000. And again, it's another way that the private sector can invest in community development for the purpose primarily of non-housing. So while the low-income housing tax credit is focused for affordable housing, the New Markets tax credit is really focused for all those other community needs that we all have, whether it be a healthcare center, whether it be a fresh food facility, whether it be a job employment, job training facility. So we are one of the oldest allocatees in the program. To date, we have been allocated about $830 million. I was saying to somebody earlier today, I keep looking at my phone because we're supposed to find out today what amount we might have gotten. I know, I'm a little nervous. Thank you. But it's just another tool that we're able to use to deliver capital to the communities that we work in. So one of the areas I wanted to touch upon is that we have been working specifically using that New Markets tax credit capital tool as well as our CDFI to finance federally qualified health centers. So over the last, I think, 4 to 5 years, we, along with some of our partners, I've been able to finance about 10 transactions throughout the country. Many of those are co-located with housing that either we have financed or that others have financed. Some of them are co-located with public housing sites, so it's very important to ensure that there is a real ability to access the services. Some of the work that we're doing in our housing financing is looking at the health effects of the housing that folks are living in. So to some of what Dr. Sandel said, and I should mention she's actually on our board of directors, which we're really proud to have her as a board of directors member, and I love listening to her at board meetings. But really looking at what is happening with the residents in the housing that we're financing, and how is what we're doing contributing or not to the health. How can we, as a capital delivery, or at least an entity that has one component of capital delivery, be able to support so that that work can continue, and so that there are the types of services and the types of connections that folks spoke about earlier today, those are available, right? And so one of the things that we have done over the last probably 3 to 4 years is we have every year hired a couple of really smart interns to go into a few of the communities where we have financed transactions and do a real deep analysis of the impact. So, we made an investment 5 years ago. What is happening in that community today, and what can we understand about the investment we made in the built environment, but how is it having other impacts from, what's happening to the residents, to what other development has occurred in the community. So we just released our most recent one. This is called the Social Return on Investment. You go to our website, you can access it. We highlighted 2 transactions, one in New York City with our partner Camda, and then the other one in Denver. So really interesting information about what our financing was able to support. Certainly we don't take, we're not saying that our financing has done what's occurred, but we definitely feel like we have supported it. So, and then what I did is I just brought some pictures. So I want you all to see some of the types of transactions that we have supported. So this is a federally qualified health center in Oakland, California. That is a combination of New Markets Tax Credit. It has debt from Enterprise Community Loan Fund. We have a bank that provided the equity or purchased the tax credits, and then we worked with another CDFI along with this very well-regarded FQHC that's a multi-site, multilingual, and very culturally sensitive in terms of delivering its health services. So that's and what I love about this project, it's the conversion of a restaurant, a very old Chinese restaurant in Chinatown in Oakland, and the family did not want to continue with the restaurant and decided that they really wanted to see something for the community in the space. So we ended up with an FQHC there, which is awesome. Here's another one in Cleveland, Ohio. This site actually sits in a choice neighborhood, so this is adjacent to public housing in Ohio, so also a combination of debt and equity through the New Markets Tax Credit. Here we have Bloom Health, which has a federally qualified health center in it. It's not just specifically for a healthcare center. There's a cafe, there's a job training component to it, so it's a multifaceted pharmacy, whatnot in that project. This is Diamond Healthcare. Again, this site is adjacent to housing that we have financed through the low-income housing tax credit. So a great story to tell there. New construction, as you can see. Erie Healthcare Center. This is the rehab of a prior bank building. So it's always cool to see how they can convert something like that and make that. And again, a combination of New Markets Tax Credit and debt with the types of partners that we typically work with. So, thank you.
We're going to have just a few minutes to talk among the panelists, and then we'll open the floor to Q&A. Is that good with everybody? No? Okay. So my first question is to Annie and Julian. What are the financial tools that your funders use to support your work? And what about banks? Are banks ever involved in your conversation, and if so, how? And then, Moni, because you've already talked about your financial tools, I have a separate question for you later.
I think the financial, our funding sources primarily come from, for our services, right, for operating, have primarily come from individuals, churches, and foundations in the past. Financial institutions have been less involved in our work with homeless individuals. Being a former banker, I have my limited experience, but I think that the homeless population is tricky for banks. And I should qualify this by saying that banks, through their investment arms, through organizations like Enterprise and others, make lots of investments in all kinds of housing for homeless and other individuals. So really, I'm talking about on the operational, kind of the philanthropy side. It's tough I think it's not a core competency. Banks are regulated to serve their customers, right? And so that's who they end up casting their attention on, and homeless people, tend to not really be among those. And I also think that the approach to serving homeless individuals, which does need to be multidisciplinary, does need to involve a health component, and a complex health component, that's also maybe a little, that's a little different than how banks, their core competency for thinking. When's the last time you heard, your banker tell you had to start a yoga practice now in preparation for your retirement years? It's not really where their brains are going right away. So I don't mean that to be disparaging at all. It's just that as a for-profit entity operating in a market, where are they sort of best positioned to do good? That may not be quite where their heads are at. But I think there are opportunities. And I don't know how much I can go into. Well, anyway, I'll make this very quick. I'm sorry, Julian. When I was with Citibank, there were several departments, and so as you think about your banks and your bank partners, try to get to know them as well as possible. I know you all already do this. You ask them, how do you make your funding decisions? Remember that every bank might have different departments, right? Citibank had a totally separate community investment arm. That's the arm that bought tax credits, that invested in affordable housing and in health clinics. I worked for the community development side that really represented both the foundation but also the corporation. And between the foundation and the corporation, you might see some business heads calling a lot of the shots on how things get funded because they have certain passions. That I've definitely seen within Citibank and with other banks. But also we had a whole rubric of, these are the kind of partners that we're looking for. Partners that help give us visibility, exclusivity, right? So visibility that is, very in a leadership kind of way, right? We wanted people who could give us validation with our stakeholders, and that included policymakers, especially at the city level, but also at congressional level, regulators, and advocates. So we wanted people we wanted partners who validated us with those populations. And then we also wanted innovation, and that I understand is now part of the Q&A process for regulators, right? So my understanding is that regulators are going to increasingly pay attention to innovation when they do their examinations of banks. So, as you're sort of positioning your project for investment, either from an operation or capital side from a bank, think about those things and see if you can't position it that way.
Okay, well, I had talked a little bit about sort of how we do our funding in my presentation, but basically, in terms of operating support, we get funding from the same places that lots of other nonprofit, community-based organizations do, foundations and corporations, and grants from them. I think what's a little bit more unique about us is, we're building housing, and so we have to have the capital funding to do that. We've been able to grow over the last few years because we've been really successful at winning tax credit funding, and the problem with that is, tax credits are awarded to us as an organization. Well, we're a nonprofit. We don't pay taxes, so tax credits are actually worthless to us. So we have to sell the credits, right? And that's where banks and other sort of investors come in. They're buying the credits from us that they use to pay their taxes. They're hoping that that's going to have extra value over the 10 years that they'll be using them to pay taxes. It also lets them sort of show that that investment is also having a social impact because it's helping to build a great affordable housing community, right? And it helps to meet the CRA requirements for banks. One really interesting sort of partnership for us around funding, so for Capital Studios, which is our supportive housing facility downtown here, the company that actually bought the credits from us was United Healthcare. Okay? And so, and apparently with United, it was initially a decision that came out of their investment department, right? I mean, they were looking for ways to invest money that's gonna pay some dividends down the road. And so they, purchased the credits for that property. And then after that, and I think this was actually helped by some people from Enterprise, they realized, hey, wait a minute, we're a health insurance company, and they're doing housing and with lots of healthcare attached. Maybe we should try to work together here. And so we had this great sit down where people from the main connection for us was that United Healthcare does the Medicaid managed care for lots of Texas and lots of our residents. And so when we met with some of their folks, we realized that there were over 100 residents of ours who had United as their healthcare provider or health insurance provider, and United had a number of resources that they could bring that could help people be healthier. So then we started having these conversations about how do we utilize the resources we have to help people be successful in housing and be healthier, and connect that with the care manager and the other things that United has to help their members be healthy. And so that's been a great partnership in a number of ways, and hopefully we'll get to do some more of that. But I think that's kind of the most exciting thing that we've done on the funding side.
So Nona, you talked about the financing tools. Can you talk a little bit about the idiosyncrasies that you see from one market to another, and in who's doing the funding, what financing tools work or don't work as well in other environments?
Sure. I would say that one of the things, and sorry, so I would say one of the things that changes from location to location is certainly the public sector environment, right, and the public sector support. And so what I've heard just in the little bit of time that I've been here is that certainly here in Austin you have that. I'm fortunate I come out of the San Francisco market, so I always say to people, anything I tell you about San Francisco, don't pay attention to it, because that's a very unique place. And so we can, both in the good and the bad, right? I mean, again, whoever was talking about what our median house sale prices these days, but we also have a lot of public sector local support, the state level not so much, but certainly in pockets of places in California. And I would say that's the same in all the different places that I go to. It really varies, and the priorities vary, and I think the way that it gets the message and how you have to package it changes depending on what the priorities are locally for a city or a region. In terms of the financing system, particularly if you're talking about a low-income housing tax credit financing transaction or a new markets tax credit, a lot of the way that it's structured is driven by the regulation, because both of those programs are tax credit programs, so they not only have their program compliance, but they also are governed by the IRS regulations. And so there are very strict compliance requirements that must be met. So one of the business lines that Enterprise developed years ago, because our founder was very instrumental in creating the low-income housing tax credit code, was we are a syndicator. So we actually put together capital providers like United Healthcare and transactions that have tax credit allocation and are looking for investors. So we syndicate those transactions both to direct investors like a bank, and then we do it in pools where you have multiple investors that are coming in and putting their capital, and then we do all the underwriting, all the asset management and whatnot, and have built up all that expertise. So that's a fairly kind of straightforward, it has to work this way. So I would say public sector is probably, and the local public sector in particular, that's probably what varies the most.
So one more quick question. How do you leverage all the work that's being done in your communities, so even if people aren't necessarily partnering with you, you're benefiting from the work they're doing and vice versa?
I think that they're one of the interesting models that has come around in Dallas has been driven by the Communities Foundation of Texas, which has funded a cohort of nonprofits to implement I alluded to this in my presentation, the Working Family Success Model, which was developed by the Annie E. Casey Foundation. It's a three-pronged model that incorporates financial coaching, access to income supports, and education or workforce development services, right? And basically the experience is that you tend to see much greater increases in income and financial capability and assets when you link those three things together. So there's a whole cohort of us, City Square is one, that are all trying to implement this model and with varying degrees, right? And so learning from all of that has been really exciting, and any funders that are in the room, that's a really interesting way to implement successful models in a market. You know, you dedicate yourself to building capacity with a successful model among a lot of different nonprofits, because there's more than enough demand to go around for something like that.
All right, I actually thought of three things now. So one thing, sort of our work more broadly. So we are part of a network called NeighborWorks, and I know there's some NeighborWorks staff here. That helps to fund and provide technical assistance to groups like ours that do affordable housing throughout the country. And so we really get to benefit from learnings from all different parts of the country and organizations doing different kinds of housing and get to contribute to that. So that's been great. At more of a community level, one initiative that we're part of here in Austin is called GABA, which is it's kind of a collective impact project based in a couple of neighborhoods in Austin, focused on helping to lower childhood obesity rates. So some of the Children's Optimal Health maps that I think they actually flashed it on earlier this morning, show that there are some real hot spots of childhood obesity in certain communities. And so GABA is focused on, through resident participation and bringing in lots of resources, trying to reduce childhood obesity. And so one of those neighborhoods is where some of our affordable housing communities live or are. And so we're a part of that, and then we contribute back into sort of the larger neighborhood. That's some of the things that we're doing in our community. And then sort of lastly, just in general at our properties, while we are mostly focused on the residents who live in our apartments, right, we still are part of a neighborhood, and so we always try to, sort of connect with the local schools and, make sure that for whatever kind of programming is happening in our learning centers, whenever there's space available, that we invite people from the larger community to come in, and so I think in that way we've been able to have an impact not just on people who live with us, but in the larger neighborhood.
Oh, no.
So the floor is open. We'd love to hear from you.
Love to see if anyone has any questions.
Hi. I've heard a lot of great stuff, great programs, but in the description it says how banks can meet their CRA obligations by investing, and I'm hearing that they're not. It's just tax credits, right?
No. Okay. So banks. You want to start because we're a banker?
Feel free to give some context.
Okay. So the context is under CRA, banks are required. Anna, because you felt it. Okay, so banks
Can
are
you use the
required
microphone?
under CRA to invest in
Hi.
Banks are required to, under CRA, are required to invest in community development. The interagency, which is the Federal Reserve, OCC, Office of the Comptroller of the Currency, and FDIC, are the three federal banking regulators. And they just updated the middle of July of this year the interagency Q&A on what does community development mean, and now it does include workforce development. But it also includes housing, community revitalization, extending small business loans, etc. And the whole idea is saying banks cannot ignore, if they're in a certain geographic market, they can't ignore a certain pocket, especially that where there's concentrated poverty and underinvested communities. So there are a variety of ways that banks invest. It's not just through low-income housing tax credits and new markets tax credits. And things like they could help support building the community facilities and building and making sure they're supporting CDFIs, community development financial institutions. It could be, for example, Axion Texas, which is now the LIFT Fund. They're in what now, six states, and they basically extend their if someone is an entrepreneur, current or aspiring entrepreneur and they want to get a loan to start their own business, you'll see lots of banks invest in the Lyft Fund or other microlenders, for example, who not only can consider people who are not yet bankable or creditworthy yet for mainstream banking products. They could potentially get, if they meet the microlenders criteria, they could get a microloan to start their business, but also the microlenders provide technical assistance, like doing learning about marketing, cash flow management, customer acquisition. So there are a lot of, the chart that I showed before about affordable housing and entrepreneurship and community facilities and making sure that, let's say, small dollar loan products, those are all things that banks have been investing in. These are just examples of where maybe there hasn't been a specific bank investment, but for example, Noni, do you want to talk examples of like how banks have been involved?
So through the Enterprise Community Loan Fund, which is the CDFI arm of Enterprise, we borrow. We borrow from banks, we borrow from insurance companies, we borrow from individuals, because we have a program that's specifically for individuals as small as $5,000 you can invest in our loan fund, and that capital is then available as part of that $184 million that we have available to lend to the types of projects that my co-presenters are talking about, as well as some of the facilities that I mentioned. So for us, the banks lend us anywhere from 2 to 10 year capital, right, that then we use, and typically at below market rates, because as I mentioned in my presentation, they're not only looking at the financial return, they're not only looking at the fact that an investment in our CDFI is a CRA qualifying investment, but they're also looking at the social return of that investment. So, that social return doesn't come back directly to the bank per se, but it's going to the larger community. And so there is a big part of what is motivating those financial institutions to invest in a CDFI like us. And again, we're just one of many CDFIs that are being invested in by local banks, national banks, regional banks. So they come in all shapes and sizes, and their investments look different depending on what kind of entity they're working with. I would also imagine that there is some support from different parts of banks. So the lending comes out of one part of a bank. The tax credit investment comes out typically of another part of a bank. But there's also a philanthropic piece that is not capital, but it complements the capital piece. Often banks want to provide all parts of what they have available to an entity, right? So they want to invest on the tax credit side, they want to invest on the debt side, and then with that will come the philanthropic support typically.
Yeah, I think that's exactly right. I mean, it's primarily been banks who have been the investors in the tax credits for our projects. But then I do think, that banks then feel like they have a stake in this project, and they do. I mean, they are our partner on the project for 15 years. And I think that helps to contribute towards, them being more motivated to give us grants from the philanthropic side. And like we have this whole range of financial programs. And we have some special match savings accounts that we have for residents, and we have to have a bank sort of hold those. But of course, the way we want to do it doesn't fit any existing sort of account type. And so, but I've always been surprised at how some banks, and especially credit unions, have been willing to kind of work with us on that. And I think sort of building that relationship for us that starts with the tax credits sort of makes it easier to do those kind of things later on. So match savings is all of our residents have the opportunity to open what are called individual development accounts, IDAs, where they can save up to $50 a month, and then we match their savings 2 to 1. So for $50, they're $100 in match money, but they can do that for up to 3 years, but they can only use the money for buying a house, starting a small business, or paying for college or other expenses.
I'll just add one tiny more note. Whenever you're trying to make a case, I think it's very important to be constantly in touch with regulators and policymakers. At least at Citi. The Citi doesn't have a presence in Texas anymore, but theoretically this is transferable to another bank partner. But if they know that you're talking to the Fed on a regular basis, or that you're meeting with the CFPB when they come to town, and that you're informing policymakers also about what's happening on the ground, I think that's really valuable. And I think that also helps to make a case, the housing and health thing cuts both ways, right? Mostly today we've talked about how housing impacts health, but health impacts economic mobility as well. And banks are primarily, kind of focused on the economic mobility and sort of like all the associated outcomes, right? So if we're trying to make a case for an investment that isn't like a tax credit or like an equity or lending investment from a bank into health, I would really focus on getting some people to sound the bell with you. Inform your bank about why that is critical to the outcomes that they care about, economic mobility and ability to work and the impact on the future generations. But get the people around you too that the banks really care about, and that I think will really help the cause.
And one more thing, a lot of times people ask about, well, how do I get the bank to listen to my cause? Don't just go and say you should care about housing or you should care about health. You have to put the deal together to say this is the project or the thing that I want to invest in and why, and these are all the different partners that we've gathered together and leveraged our resources. It doesn't have to be just financial resources, it could be political, it could be social capital, etc. But the point is saying, and asking, banks have their different geographic different markets, different priority areas. You have to ask them about their portfolios and ask, what is your area of focus? What is your priority and why? And that way you can have when you do that market research, you have a much better sense of which one would be the right partner, which one or ones would be the best partner for you.
I'm glad that Elizabeth brought that up. I'm Yoli Davila with BBVA Compass, and I'm actually the regional CRA officer for the state of Texas. So it's very important to know what markets we do cover, because if we're saying no, it's not necessarily that we don't want to invest, but rather we have other strategic priorities. For example, I can tell you that in Austin, we partner very closely with foundation communities, not only through our light tech investments, but through our grants that we've given them throughout the years, and just in other ways through CD services, promoting or financial literacy, homebuyer education, things of that nature. I know that we're also working with Enterprise right now, expecting an application from them for an investment in an equity equivalent loan. So again, those are the types of investments that we're doing. And so banks are definitely investing, at least for BBA Compass, I can speak to that. And in 2014, we made an $11 billion commitment for the next 5 years in community development. So that's going to include everything from community development loans, so that's financing, where we can give concessionary pricing depending on what the project is. That includes investments, that includes grants, and mortgages for low-income borrowers. But I think it is really key to look at that market and what geography we cover, because BBVA, for example, we're in only 7 states in the country. And so if you're bringing us something where we're in a market where we're completely over-invested, completely saturated with investments, my priority is going to be looking at Laredo or Gillespie Kerr, where I have no investments, where I need to really focus on that, versus some of my bigger markets where I know I'm already with LIS or with Lift Fund or with other big organizations. So I just wanted to put that out there. Thank you.
When you were describing your cottages program, you used some numbers that I think we've used for years. If you leave a person on the street, it costs us $40,000 in public support. We put them in housing, it's $15,000, and we've saved somebody $25,000. So have you experienced any success in getting your hands on any of that $25,000 that we've saved somebody? That's maybe saving the criminal justice system, saving healthcare systems. They're saving these dollars. Is any of that coming back to you for the work that you've done? Have you figured a way to crack it?
Yes, I think the way that so like I said, we were attempting to create a pay for success model, right? And I don't know I can't remember which presentation this was in before, but the idea is the investor pays up front, and the investor gets paid by the entity that has the cost savings after the service is delivered, right? So the investment, so basically we weren't able to get that. We couldn't seal the deal on that. It was everybody was a little too, it was worrisome. It was a pretty early time too in social impact bonds, 4 or 5 years ago, right? So what we did get was a commitment we got money from the city of Dallas, we got money from Dallas County, and so I guess you could say that was them saying, okay, we anticipate we're going to see some cost savings here, so here you go do it. So they did it without getting any real promise, but so that's why we were really excited about the program evaluation. So I think that what's really going to happen is hopefully this works out, and then the county is more risk-loving in terms of going forward on projects like this, and can put together the deals that and the investors that realize that cost savings for the people we're trying to serve.
Is any of the information totally new to anybody? Everybody's in the room. Can I see a show of hands of people who have? How many of you seen social determinants of health information before? So most of you are familiar with it. How many of you actually done the work where you're actually in working with other disciplines, other sectors that you used to not work with? So almost the same numbers. So what are the biggest challenges that you've all had, if you have had challenges, in breaking down these silos, working with other sectors, and trying to make investments that are sustainable and impactful in the communities that you serve?
Just sharing data.
There are some things that bring value to health that cannot be monetized, like vibrant public spaces. So it's really hard to get an investor to want to back a public space improvement.
I think a lot of us nonprofits in particular don't think the way you think. So it's hard to put together what we need within the perspective of an investment, within the perspective of terminology. All of that is foreign to many of us. So I think we need some one-on-ones from you guys, a lot of that. And this is helpful.
When we built our building here in East Austin with a new markets tax credit deal, one of the things we were able to do was to build a little bit larger building and make space available to some other nonprofits. And what we were able to do then was to team our mental health services with a workforce provider and a literacy provider. And they created a really nice synergy within one space, and then we built housing next to it. So that's where we were able to crack into other different disciplines that supported ours.